Our speaker for today is Mrs. Blessing Bolarinwa. She is the Director of Speech Up Services. She's a behavior analyst in progress. In fact, she just finished her coursework and she is just waiting her certification. So we have brought you good professionals to speak to you in this conference. So please relax. You know, she's the Niger therapist. That's what she is, the Niger speech therapist. So Mrs. Bolarinwa, you have the floor. I love to call her Bibi. Bibi, you have the floor. You're welcome.
Good morning, everybody. all these accolades for me alone. Good morning. It's an honor to be here, our CEO. And congratulations to Rubies on your 2nd anniversary. Greater heights, I pray in Jesus' name. Please, can you all hear me?
Yes, we can hear you.
Okay, all right, thank you. All right. So I'll be sharing my screen. Okay, so once again, thank you for having me here this morning. It's a great honor to be here. All right, so my name is Blessing Bolarinwa. Yes, and I'm a speech and language therapist. So today, Rubies they've given me the assignment to talk on therapy as a pathway to independence. Okay, so today we are going to be focusing on milestones, skills, strategies, and how to balance independence, at home. All right, so every parent wants their child to thrive. We want our children to be able to do things on their own. There's a point that they get to in life, like at each stage, you're looking out for skills, for milestones that they're supposed to achieve in court. And at that point, some children may meet those milestones, some may not. Okay. And that is where therapy comes in. And at every point in time, we tend to compare, especially if the parents, if they've had a child before, they tend to compare milestones and all of that. But regardless, either a child is neurodivergent or neurotypical, all children need to have a level of independence, okay, at every point in time. So in children, I said independence refers to gradually acquiring the skills, confidence, and responsibility that is needed to perform age-appropriate daily activities. So, for example, feeding, dressing, toileting, and also independence in making simple choices and being able to solve problems. I mean, that's the cognitive skills there right now. Also to manage emotions and social interactions, taking responsibility for personal safety, learning, and self-care. So we have to get something right. That independence is not doing everything alone, but learning to function with decreasing level of adult assistance as they grow. Even as adults that we claim to be independent, there are some things that we still have to look out. We still have to look up to people to support us. So it's the same thing here. When we say independence, it doesn't mean that we are leaving the child to do everything and anything. So it's just that you're supporting them, but as time goes on, as they master the skills that you're trying to introduce to them, you are decreasing level of assistance as they grow. Okay, so I'm going to continue introduction. Please, can you hear me? Can
yes,
everybody hear me? Okay, all right,
yes,
thank you.
We can, but not that audible.
Is it the same for everyone, please?
No, it's audible for me.
Okay, all right. So I think you want to check your device, ma'am, to be sure that it's not from your end. All right, thank you. So as I said earlier, that independence don't just happen. So it unfolds in stages, and it is taught, modeled, and supported. So what it means that what I mean by it unfolds in stages is that what you expect a 2-year-old child to do, you don't expect a 1-year-old child to do it developmentally. Okay, so independence happens per time in stages according to developmental level. Okay, and like I said, therapy offers a structured, practical way to help children. Not all children need therapy, apparently, but there are some that would benefit from intervention strategies. So children that are neurodivergent, children that have communication disorders, developmental delays, and so on and so forth. So any goal of an effective intervention therapy It should be to help children to thrive academically, emotionally, socially, physically, and even functionally, most importantly, functionally. So, and the end goal of every therapeutic intervention is independence. That's what we're working towards. So if any therapist is working with a child, your end goal should be, I want this child to be independent in the skills that they are lacking. So, moving on. So now I'm going to talk about key independence milestones before we move to strategies. So we have the early childhood, which is 0 to 5 years. At this developmental window, we expect that children will be sitting, crawling, walking, feeding self, using utensils, potty trained, and basic expressions like. So for age 0, of course, we do not expect that a child will start sitting, crawling, and walking. So this is just for this particular window. That's the early childhood. So early childhood is 0 to 5. Okay. And then for middle childhood, you have age 6 to 11. At this age, we expect that children would dress independently. They will do homework with minimal help. They will manage chores, navigate social roles. That's for 6 to 11. That's middle childhood. Then for adolescents, 12 to 18 years, organizing routines and time, decision-making and problem-solving, personal hygiene and money management, building healthy relationships. Okay. So beyond academics, independence requires more than just academics. So academics is just like one piece of the puzzle. For children to be independent, for them to be actually independent, they need further skills, functional life skills that will support them. So this, which is what I'll be talking about in the next slide. So for example, executive functioning, very important. So this part of this skill works on planning, organizing, adapting to changes, and so on and so forth. Then we have the communication skills, so ability to express oneself clearly. It is also a very important skill for independence. Understanding cues, asking for help, also motor and sensory regulation is also another critical skill for independence. That's the ability to coordinate tasks daily. If one seems to be uncoordinated, then the tendency of that person being independent might be quite low, because we need enough coordination for us to be able to carry out tasks daily. Okay, so also the skill of self-advocacy and confidence, being able to say no, making choices, and also emotional regulation, coping with frustration, calming down, being able to adapt to different forms of emotions. Okay. So now this brings us to the practical therapy strategies that parents, therapists can use for children, especially those that are neurotypical and they are not yet independent enough to carry out tasks on their own. Okay, so now we'll talk about the visual schedules. So visual schedule is using pictures to illustrate what's going to happen in the child's life that day. So a child wakes up early in the morning, they see a picture that when you wake up, you see brush your teeth. It's a picture that has a child maybe brushing. Then from brushing, there's an arrow that takes you to take your bath. It's just telling the child, giving the child a step-by-step analysis of what's going to happen that day. And this works for children that struggle with transitions, children that find it difficult to adapt to change, So, and it also helps their cognitive skills. So they can predict what's going to happen next instead of throwing tantrums, especially if they are not independent yet. Also, there's another strategy of using the first and then strategy. We call that the grammar principle. So for example, a child wants to play without doing their homework. You tell them, okay, so you're going to do your homework first, then you play. That way the child understands that that at each point in time, there are processes that have to follow, So this helps the child to like settle down. It helps the child to be accountable, do what they're supposed to do in time, and then the then strategy that then serves as the reinforcer for them. So it serves as it serves as what we reinforce them at that point in time. Of course, after doing your homework, then you can play. Also, there's a strategy of timers and predictability. So for timers, it's that if you want a child to do a task, for example, you're working on a child's attention span, and you want them to be able to do this for 5 minutes, maybe string beats for 5 minutes, you set a timer. You make the child understand that you're setting a timer, and after the timer beeps, after the timer has ended, then they would have to stop whatever they are doing. So this helps the child to it teaches the child to effectively manage time and also be able to predict what's going to happen next. Another strategy that can be used is modeling self-talk. So this is very important for communication, for cognitive skills, and for intellectual processing. So modeling self-talk means that you are describing what you're doing and stating why you're doing it. For example, as a parent, maybe you put your shoes at a particular place in the room or something. Then you can tell the child, I'm putting these shoes here so that I do not forget when I'm going out. That way the child is able to, you're building the child cognitive skills, you are teaching them communication, and also you are also indirectly teaching them that there's a reason and a consequence for everything that is being done. Another strategy that we can make use of at home is breaking down big tasks. That's task analysis. Okay, so for children that are not independent yet, or they are still working towards independence, we break down tasks. You don't just give them big tasks and expect that they're going to understand. They may not understand. An example is if you want a 4-year-old to clean their room, not clean per se, just to make sure that you're teaching them to arrange their space after use. Okay. Instead of you just saying, go and arrange your room, they may feel lost. Like, what do you want me to do? They may not even know where to start from. So you break down the big task by telling them, for example, go to your room, pick up your clothes, and lay the bed. That way you've broken the task down and they can follow it step by step. And as you're doing all of this, we should also note that we should always praise efforts, not just outcome. It's not every time that there will be positive outcomes if you when you're working with children. There are times that it is just the effort that is needed at that point. So at the point where it is just effort and not outcome, it's okay for you to praise efforts. You can say something like, oh, you tried your best to do that. Well done. And of course, when the outcome comes to, you also reinforce them. You motivate them to do more. Also use natural consequences to teach independence. An example is maybe a child forgets to bring their water bottle to an outing. Maybe they're supposed to hold the water bottle and they forgot somehow. It's okay to use natural consequences. Instead of scolding them, they get the natural consequences of going thirsty. I mean, it could be for a while, but later you can also now give them water or whatever they need at that point in time. So these strategies are not magic, but when they are done consistently, they empower children to do more for themselves over time. So when a child uses visual schedules, you teach the child, you do this first, then that. You use timer, you model self-talk, you break down big tasks, you praise them, and there's reinforcement at every point in time that the child needs it. Then you're empowering them to do more. You are teaching them skills like cognitive skills. You're teaching them social emotional skills, and you're also empowering them. Goes on, they become independent, and they may not even eventually need all of these strategies again, because of course they've passed that level they used to be. Please, can anybody hear me? My network is saying that it's unstable. I don't know. Can you still hear me, please?
Was glitching,
Okay,
but we can.
thank you. Sorry about that, please. Okay. All right. So we want our children to be independent, and at the same time we want to support them. Okay. So there are ways that we can avoid being over dependent. As a parent, when you see a child, when your child wants to do something, there's this, and you see that they are frustrated, they cannot do it at that point in time. There's this urge to always want to be quick to help them out. That is not going to make them independent, because at the end they would not even want to try. So number one, don't rush to rescue. Let children try. It's okay if they're trying to open a bottle and it's quite tight, or they're trying to tie their shoelace and they are not able to do it, instead of rushing to help them, ask yourself or ask them that what can you try more. Don't rush to to help them. Let them try, let them put in effort. Okay, so also give choices within boundaries. So do you want this or that? Is also another way to avoid overdependence. You can also teach safe failure. Allow your child to pour their drink, allow them to um do things that you know that they are safe for them at that particular point. So if they're trying to pour a drink and it spills, it's good, it's okay, it's fine. So when you allow them to make mistakes, you are teaching them coordination, you are teaching them responsibility, and you are teaching them problem solving. If we don't make mistakes, we don't learn. So after they had poured the drink, and you see that after they have poured the drink and they spill it, it's okay for you to now correct them and teach them the right way to do it. Also, use scaffolding, gradually reduce support to promote mastery. So if you have been teaching your child to brush their teeth with hand over hand, gradually you can reduce adult support for them to be able to practice on their own. Okay. So when we're talking about independence, we have to know that therapy is just beyond the four rooms of a therapy room. If parents, teachers, caregivers, if they're not on the same page with the therapist, then independence may feel unachievable, because it's not a one-man's job. It's everybody has to be on the same page. If a therapist is working on listening skills, attention, then everybody at home, in school, they are doing the same thing to promote and to help with independence. Okay, so in conclusion, independence is a journey. It's not something that happens one time. You have to keep practicing. You have to keep on being at alert. You're taking it step by step. You don't need to be overly frustrated about it, especially if you have capable people that are supporting you. Okay, so it's a journey. It takes time, it takes consistency, it takes perseverance, actually, and you have to be very patient. Okay, so therapy equips, but like I said earlier, caregivers must reinforce daily to attain independence or mastery. Okay, so for a child to be independent, they have to try, they fail, they adapt, and they also grow. So this brings us to the end that independence is empowering. Children need to do as much as they can for themselves with dignity, confidence, and safety. So the goal is not for children to need us less, but to rely on us in the right way. Thank you very much for listening. So now we can take questions. Maybe I didn't touch what
so much. That was really
good.
Now is the time for questions. We have 10 to 15 minutes for questions. I'm not sure. Do we even have up to 15 minutes? How many minutes do we have for questions, Bibi?
We can take questions for 5 to 10 minutes. Yeah, 5 to 10 minutes is okay.
So we have questions for 5 to 10 minutes. Now it's time to ask your questions before she gets back to another assignment she has this morning. Thank you so much for creating the time.
You're welcome.
Yes. There were people asking questions about therapy yesterday. Today is the time. Now is the time for that. Okay, yes. Ngozi Egumba, can you unmute? You can unmute and ask your question.
Okay, good morning, ma'am.
Good morning.
Right. My question is this. I have a child that is battling with language interference. I believe at home, the caregiver or the nanny speaks only Igbo language. So in the school, I use English language to teach him. And he's an autistic boy of 4-year-old. So now the problem is, I feel he's non-verbal. So I feel the boy is battling with that language interference. So how do I cope this? How do I manage it? Because I know it's going to take a long time, because what he knows is Igbo language, what he hears is Igbo, and I'm losing English language again. And this is a non-verbal autistic child. So how do I manage this? Because sometimes I find out that to give him instructions, it doesn't, unless I point at it. I know that, okay, he has that challenge as an autistic, but that language issue, I know it poses a problem. So how do I manage it? Hello.
Okay, thank you for your question. So if I got it correctly, Miss.
Network.
Yeah, network.
Hello,
Can you hear me?
hear me?
No,
Okay, yes,
I
we can.
can't. I can hear now.
Sorry, can anybody hear me? My network.
Yes, we can hear you
can
now.
hear now. Sorry, you are in Nigeria. Network threw me out for a minute. Okay. Sorry, please, can you come again with the question, because the network was quite bad, so I could not hear you clearly. Could you please come again?
Okay, can you hear me now? Can you hear me now?
Yes, I can hear you.
Okay, so I said the boy I teach
Yes,
is
I
4
can.
years old. So he's 4 years old, and I think he's having a kind of language interference. At home, the nanny that takes care of him uses Igbo language. That's the only language she understands. So, and in the school, I use English language. So he's a non-verbal autistic child. But the problem now is I feel that language barrier is going to be a big problem for him to listen to instructions, because sometimes he does, but I believe that language of instruction is really interfering for him to progress. So how do I manage it? Because there in the home, he uses Igbo language. In the school, I use English language. So how do I manage it?
Okay. All right, thank you for your question. So to start with, we have to understand that. Can you hear me, please?
No, I can hear you now.
Okay, all right. So I was saying that we have to understand that research has shown that using 2 languages would not make a child not speak. Bilingualism, in fact, it's a step forward for them because they get the opportunity to learn 2 languages, and for children, their brain are still receptive to learning, so it can accommodate more than 1 language at a time. So it's not going to cause speed. It's not the reason the child is not responding to instructions. Of course, we want follow-up at home. So I want to ask that the caregivers, is it that they don't understand English at all, or they're unable to speak English at all?
Yes, she doesn't. She's an auntie from the village, so she has been with them. It's only Igbo language she speaks with them.
Okay, and she's the only one available to care for the child, I mean, at the moment.
Yeah, but he has other siblings that cannot even speak the Igbo. They speak English, but the major person that takes care of him is that Igbo language auntie.
Okay, all right.
Yeah.
Okay, so in this case, you continue with what you're doing by using English language and be consistent with your instructions and, of course, the goals. Okay, so and also we have to, I don't know if there's a way that you can like help the caregiver. Even I believe you are able. If there's a way you can break down instructions or what you want the nanny and the caregiver to do at home, okay, using maybe Igbo language, just simplify it. Okay. So and also when you are working with the child, you can also use songs, use rhymes, encourage turn taking, and you can also read books. But the thing is that using both languages is not going to interfere with the child's language learning. That's not it.
Okay.
Yeah.
All right, thank you.
I want to ask you too. Are you the therapist or you are just the class teacher?
I'm a therapist in progress. I have certificates. I'm also getting this one from you, Mrs.
Okay.
Yeah.
Okay, no problem. I just need to be sure, because if you are just the class teacher, you might also not know what strategies to use. But if you're a therapist, I'm sure what she has said would make a lot of sense to you.
Yes.
Okay, so do we have any other question? Okay, Polish diction, please unmute and ask your question.
All right, good morning, everyone. So my question is, how do you help a 10-year-old child who finds it difficult pronouncing a particular sound? That's the SH sound. So when the child wants to pronounce a word like wash, he's unable to articulate that SH. he finds it really difficult. So I don't know if as a language therapist, there's a particular way or method or information that should be done or can be done to help such child.
Okay. Yeah, that's a good question. So if a child is finding it difficult to pronounce the sh sound, that's like an articulation disorder on sh. Okay, so the first thing you want to do is create awareness for the child and listening. So before you start working on words, you are starting with the sh in isolation. So you're teaching the child just the sound. Make the child practice. You can even do it in a very fun way. Make sound like you're telling somebody to keep quiet, and let the child also imitate you while you do this. So when the child has mastered the in isolation, then you can move to 2-syllable words, like maybe you can teach the child to say shh, then you add another sound to the to the to the she. Also, so when the child has mastered that one, you can now move to word level. For example, teach it out to you start from because we have 3 different parts. Every word has 3 different parts. So there's the initial stage, there's the media stage, and there's the final stage. So you take it one after the other. Teach the child starting from the initial sound first. So shoe, shirt, show, and as you're teaching them, you're showing the child pictures. You're also showing the child visuals, most importantly. So after the child has mastered the initial, that's the first sound in the word, then you can now move to the middle sh and then the final sh. So it's consistent actually, because for a child that is 10-year-old, both the parents, the therapist, and the child, everybody has to be very, very patient, because at that age we expect that he or she would have mastered that sound. But since it's coming later than expected, then you have to be really consistent and work it through with the child. So in summary, you start with the sound in isolation before you move to word at the initial, middle, and final stage. Then you introduce the child to sentences. Make the child read short sentences with the shh. Okay, you can also do this in front of a mirror, so that the child sees the placement of your mouth, as you walk. So if you are doing shh, the child is seeing that your teeth are together while doing the shh, and you can also encourage them to do it. So with practice and consistency, of course, there would be improved prognosis. I don't know if this makes sense to you. Polished diction, I think.
Yes, it does. Thank you.
Mm.
All right, thank you. Do we have any other question? One more question before we go. Okay, I want to assume there's no other question. Thank you so much, Bibi. Thank you for coming. Thank you for squeezing out time for us this morning. We do not take it for granted, and I'm sure we've all learned. Even me, I was taking note because I've learned a lot from your session this morning. Thank you so much. So
You're welcome.